Star FM sounding good all the time. This is the second hour of the Morning Galaxy, and I have special guests on the other end of the line. I have Mr. Josie Sibanda from the media. We want to talk about future pandemic preparedness, and I also have Andile Sibanda, who's also from the media and ready to get into the show for today. Good morning and welcome to the show.
Good morning, how are you?
Morning.
I'm good, thanks. I'm speaking to Mr. Joe Sibanda, right?
Yes.
And Andile Sibanda, good morning to you. Welcome to the show.
Morning, how are you?
I'm great, thank you. So let's get into it. Future pandemic preparedness. So for most of us, we witnessed, we actually lost loved ones because of pandemic. That's COVID-19 pandemic, and most people also, got really, really sick to a point where they felt like they were gonna die. We lost loved ones. Things changed. Everything changed after that, and we want to be a nation who is ready for for future pandemics. So maybe the first thing that we want to know is, what is a pandemic?
Well, a pandemic basically it is a disaster, an unforeseen one that comes at any time without us. It can be any disease, it can be anything that we're not expecting, that is not common. Exactly.
All right. So there was a lot of disinformation around COVID-19 and its vaccines. So are there any mechanisms being put in place to guard against disinformation for future pandemics?
Well, most of the disinformation came as a result of misinformation, actually. As most people lack the necessary knowledge, right? And in turn were open to hearing and spreading whatever they came across. When someone told you, okay, this and so forth, without even thinking, you're just going to spread that information because you did not know what was the right information. So some of the measures which are now being implemented include use of trusted messengers to reach people. As this boosts our credibility, like maybe people like religious leaders, community organizations, and so forth are more likely to be listened to by the public than someone maybe that they don't know from abroad, and they just say, okay, this person is saying this and this and this and so forth. And if they don't understand that person, if they don't trust that person, it's most likely going to lead to misinformation, as they'll be more open to hear from someone that they know and trust.
So are there any mechanisms being put in place kuitira kuti kana tikazwa information isiriyo tineva chati vachatidzoreredza kuti tizwisise kuti aiwa iyi information iyi ndeyekunyepa, iyi information iyi ndiyo yatiri kufamba nayo? Any mechanisms that are being put in place currently?
Well, as of now, some of the methods that are being done, for example, at first you have to identify the misinformation. Some of the methods that are being put in place are methods like social monitoring to identify and analyze misinformation circulating. Though these are not yet as effective, the initiative is room for growth, with penalties being awarded to misinformers. So right now they're mostly focusing on ways in which they can use to identify the misinformation, and then upon doing so, then they would educate people, necessarily correcting them on what might have been spread.
Okay, and Dr. Tedros of World Health Organization announced that COVID-19 is no longer an ongoing health issue. What measures can be put in place to ensure that we are well prepared for future pandemics?
Well, there are measures like setting up a financial body directed at addressing funds of a pandemic, so that distribution of vaccines is not solely dependent on donations, as was the case with COVID-19. Because we noticed that when we depend on donations for vaccines, right, the process is really lagging, and most people in turn they die before they get the necessary so that people are always ready in the event of pandemic. And then maybe also maybe making use of a more hands-on approach on educating people about the ongoing pandemics at any moment. Because if people are given the true and accurate information, they are less likely to pay attention to grapevine, and in turn it would really help with swift operation and people accepting the vaccine so that they can be helped without them fearing with this vaccine is going to kill them or injure them and so forth.
All right, thank you so much for that. And now we get to, speak to Vamini Vedu, speaker number 2, so that we get a better understanding of preparedness for future pandemics. So how can are the rural communities prepared for future pandemics?
All right, so number one, we need to strengthen the healthcare infrastructure, that is, provide provision of adequate healthcare facilities that includes the hospital, clinics, special treatment centers. Those should be a priority. And then also we need to improve or strengthen communication system, that is, build a robust communication network to facilitate the dissemination of accurate and timely information to the rural centers. Also engage community engagement, that is to educate the rural areas or communities about the pandemic, including the prevention, the strategies, and also the practices. And then also we can improve the access to essential resources, that is the availability and distribution of essential resources such as the protective equipment, medication, vaccines in the rural communities. And then also allocating adequate funding to those remote areas. Yeah.
Thank you so much. I'm speaking to Mr. Josi Sibanda from the media and Mr. Andy Les Sibanda. We are focusing on future pandemic preparedness, and we have already spoken on mechanisms that are being put in place to guard against disinformation of future pandemics. We've also, focused on measures put in place to ensure that we are well prepared. And lastly, how can information and knowledge about future pandemics be disseminated to rural areas?
There is the use of multiple communication channels, that is the use of newspapers, flyers, posters, and also considering the current technology, there is the use of WhatsApp, texting, and other mobile phones. And then also there is development of clear and simple messaging, that is the use of simple language to avoid jargon and complex terms for the people. It makes them really understand what is being said. And also leverage community health workers and promoters, that is to engage and train community health workers, village health promoters, so as to increase the number of knowledge in the community. And then also there is employ peer-to-peer communication, that is establish support groups, community forums, virtual network where individuals can share and experience, ask questions, and learn from one another. And also there is we need to provide localized information, that is the tailored information to specific context and also realities of the communities, that is to address transport issues, cultural issues, and also health facilities. I think with these we can surely be helped in the future to disseminate the information.
Thank you so much for coming through. If somebody wants to get a hold of you and maybe they have contributions regarding the topic that we focused on, or maybe they have questions, how do they go about it?
So to normal, you can get hold of me on my WhatsApp number 078 495 7197. You can call, text anytime on that number.
Sure. Thank you so much for coming through. Right. So, yeah,
Okay.
we get to the end of it. I was speaking to Mr. John Sibanda and Andile Sibanda from the media, focusing on future pandemic preparedness. I hope now you are enlightened, and we can also share with one warikuma rural areas zvatinenge tazwawo, and you also need to hear it from the biggest radio station, because panapa kando pane news dziri authentic. So we are also a part of information dissemination team inonza zviro zviri authentic. Star FM sounding good all the time.